Okay, recording. Okay.
You ready?
Yep, sure.
Okay, so thank you so much for accepting my invitation for
Sure.
the short conversation. So now I know that you are so busy with
No
your
problems.
job, um, so now I want you share with us about some advice to avoid some accidents and also prevent some hurts and pain during the exercising.
Okay.
So yeah.
Oh, so, yep.
Yes. Okay. So first question: what inspired you to specialize in sport medicine?
Okay. Um, well, I've been doing sports medicine for about 15 years now, and that included doing a training program for about 4 years. What inspired me to go into sports medicine was when I was a student. I went to a conference about sports medicine, and I found it very interesting. And I thought, wow, this is a very varied field where you combine orthopedics, rehabilitation, imaging in a very sort of concise way. And so it was probably my first exposure to sports medicine. And then after that, when I finished my primary care training, I thought about primary care and I thought it's very nice, but it doesn't really fulfill me with what I want to do and what I want to achieve. And so then I remembered about my sports medicine training and how, my sports medicine conference that I attended, and it reminded me of how interested I was in that. And so I started looking for opportunities in sports medicine, and then I started the training program. So I've not looked back since.
Yes, because the career path I think is a long story because you take a lot of time
Yeah.
to become a sport medicine doctor and also the specialist.
Yes.
So if I remember, so maybe your dad's also your doctor.
Yeah, my dad's also a doctor. Yeah. So my father's a primary care physician as well. Yeah.
So he is one of the factor affect you in your career path.
Yes and no, in the sense that I guess I became a doctor because I was inspired by him. And then I went into being a GP, maybe because of him as well, following his pathway. And then I guess maybe I realized that, it takes a lot of courage and effort to be a primary care physician, and hats off to them. But I felt that my area of interest was slightly different to that. So I wanted to have something where I could have a slightly different kind of breadth of experience. So working with elite athletes as well as amateur athletes and even older patients and younger patients. I see a very wide mix of different people.
Yes. Okay, so how long have you taken on the journey to get the degree bachelor to become the specialist? So how many years you have to?
Well, I started my undergraduate in 1998. I finished that in 2004. So in between, I did a bachelor's in neuroscience, and then after that, I did different kind of jobs for about 2 years, and then I did my primary care training, and then I did my sports medicine training. So I would guess maybe about 10 years. Yeah.
Oh, yes.
10 years from graduation till finishing as a consultant. And then I've been doing that ever since. So yeah.
Yes. So some my students want to become a doctor maybe in the future. So you can tell them some difficulties they have to face.
Well, of course, the first one, I guess, that most students will face now is the actual admission to medical school. I'm sure it's still fairly competitive and everything. And I think it's important to develop that interest early, so try and gain experience in terms of exposure to clinical environment, different specialties, understand whether it's something you really want to do or whether you're feeling pressured to do it, and really having a passion for it. And once you've got that, and once you're in, it's about being consistent. It's about being studying regularly, not all in one go.
Yes.
You understand?
Yes.
And one of the key elements to that is to obviously go for your lectures regularly, just kind of review on what you do, and actually also have a good time as well at university, because if you don't enjoy, then it's very unfortunate. You know, you're not getting the full experience of university. And then once you finish, it's about gaining experience in different specialties, seeing which one actually really ignites your passion. And if there is one that ignites your passion, then you can go further into training with that. So some people are very passionate about surgery, or some people are very passionate about ophthalmology or cardiology, and they really sort of pursue it. And they look at all avenues to pursue it, whether it's training or whether it's research, and so on. So my advice to you is, first of all, think whether it's genuinely something you want to do. And if it is something that you want to do, start to gain the experience and exposure now, so that you can, when you go for your interview or the medical school kind of admissions, you have a stronger position to get in.
Yes. So to become the good doctor, so maybe will take a lot of time, and also we have to work hard, and also we have a big love to our career.
Yeah, I think it's important to be passionate about what you do, but also you need to work consistently. I don't think it's always about working hard all the time, but it's working consistently.
Yes, okay, I see. So, okay, so what does a typical day of your practice look like?
So my practice is currently here at Farrer Park, and normally I'm in clinic, so I might see patients who have acute injuries or who I've seen before, and I'm sort of following up with them. They may require investigations such as ultrasound imaging. We may require MRI imaging or other forms of investigation such as blood tests to evaluate what's going on. And then a lot of the time it's treatment. So whether it's ultrasound guided treatments here in the clinic, or sometimes we go to the day surgery setting to do treatments there as well. So the treatments are for a variety of different things. So it could be for wear and tear arthritis, it could be for back pain, it could be for ligament injuries, muscle injuries, and so on. And so really the idea is to try and heal things and restore function without necessarily needing surgical treatment. So it's quite varied. And then sometimes I go to sports events. So I was at the swimming here in Singapore not too long ago. Sometimes I cover football or golf. So it depends on what I'm doing on the day.
Yes, so busy, so I think so. So what is the most common injury you treat in patients?
I would say two of the most common things that I see are ankle and knee injuries. So ankle from sprains, people running, playing sports, and they twist their ankle and they damage the ligaments. The knee injuries from, again, running and twisting, and usually the ligaments or the meniscus that they injure. So yeah, very, very common. But actually I'm, as much as I see that very commonly, the thing that I really enjoy treating as well is shoulder and back pain. Yeah, because I think that when you've had shoulder and back pain for a long time, it really does affect your function a lot. And to get somebody saying, oh, actually it feels really good, that's really nice.
Yes. So there are unavoidable just pain during the practice sports and also exercise. So how do you decide whether the athlete or patient should rest, rehab, or undergo surgery?
Oh, okay. So I guess the biggest question is, how is it affecting you? You understand? And at what stage of the injury are you at? So if it's an acute sort of injury, you could try resting, offloading, icing, and compression, and reevaluate a few days later to see if there's improvement. Okay. If there's a significant injury, let's say the ligaments are torn, or the meniscus is torn, or something big is happening and it's affecting the function, then you may consider doing some sort of treatment earlier, so to try and shorten that recovery period. If, let's say, the injury is not so bad, you may consider a more conservative approach, so rehabilitation, seeing a podiatrist, or taping, and different treatments like that. And then if it's been a chronic thing, so something that somebody's been having for a long time, and they come to see you because they're just not getting better. At that stage, you may intervene earlier because they need it, because they're not necessarily getting better. As far as possible, I try and do all the interventions so that they don't need anything more invasive.
Okay. So the prevention is very important. Yes.
Yeah, prevention is very important.
Okay. So what roles does prevention plays in sport medicine?
I think prevention is very, very important in sports medicine. I think a lot of research in sports medicine has focused on injuries, how injuries happen, and how to prevent them from happening, particularly in the elite sports environment. So when you have somebody who's in elite sports and they've injured themselves, they can't play sports, right? So it's a huge impact on the individual as well as the team. And so a lot of the research has looked at, for a particular injury, what were the risk factors? And you can divide risk factors into intrinsic and extrinsic, so internal or outside, yeah? And so when we're talking about risk factors in sports medicine, we try and eliminate or mitigate as much of the extrinsic risk factors. There's maybe certain ones that we can do internally, but most of it is the external stuff. So the environment, shoes, whatever surface they're playing on and everything. And your question being, how important is it in sports medicine? It's hugely important. It's very, very important. And lots of work has gone into it. From a personal perspective, when I've had athletes or patients who've had injuries, we also look at what might have contributed to it, whether it's how they lift a weight in the gym, or how they run outside, or what shoes they're wearing. So we also have a consideration of that when you're consulting someone.
Yes, yes. So people say that prevention is better than treatment and cures. Yeah.
Well, prevention is better than treatment, yes, but sometimes you also have to consider prevention in terms of after they recover, how do you prevent something happening again?
Yes. Okay. So now technology is very important into treatment and surgery also. So how has technology changed the way you diagnose or treat patients?
Well, I think first of all, from a medical perspective, technology has evolved a lot. So previously, you used to be reliant on X-rays to see if there was a fracture and so on. But actually, as things have evolved, we've got ultrasound, and ultrasounds have gone from being very, very big machines to being very small machines. And even in my clinic, I have an ultrasound machine that I can use and look at patients with. And then availability of things like MRIs and CT scans to look at more serious injuries. So I think technology has certainly helped us from a clinical perspective in terms of imaging and getting things assessed more thoroughly. From an athlete perspective, things like wearable technologies, things like monitoring, things like the Whoop or the watches that we wear. These give a lot more feedback in terms of physical activity levels, stress levels, rest. It tells us how much load the athlete might have done. And so through this, we can start to build a pattern and see when we're overloading the athlete, or they're not having enough rest, or what could be the contributing factors to it. And if you're in an elite team setting, you can monitor these kind of aspects of it and then say, hey, maybe you've done too much this time, or why haven't you been able to push yourself as hard as you normally push yourself? And has there been something that's contributing? So I think technology has made a huge part from a huge difference for clinicians, so doctors, in terms of assessing and treating patients, but also in terms of performance, in terms of monitoring and looking at how athletes are performing. Yeah.
Yes. Okay. So technology also is very important. Yes, in the modern medical fields.
Correct.
So, what's mental health challenges do athletes face during recovery, and how do you support them? Because I know that athletes they try to push their limit and try to take back in as soon as possible.
Yeah.
So yes.
Yeah. I guess the mindset that patients have, or anyone has, when they injure themselves is, oh my goodness, what has happened? Will I ever be able to do what I do again? And for anyone, that's a very frustrating and that's a very depressing situation to be in. So even if you're walking, or you sprain your ankle, or maybe you've picked something up and you've hurt your back, the first thing that goes through your head is the worst case scenario, that I'll never be able to walk again, or I'll never be able to, lift anything or anything again. Now, if you put that in the context of an athlete who has to perform to do their job, or to do what they're passionate about in terms of achieving their goals and everything, that can be magnified a lot. So that whole mindset can be affected a great deal. So I guess in terms of helping them and trying to get them to overcome it, the important things are early assessment, looking at what the problem is, putting in interventions to kind of help with the injury, but also looking at things from a more psychological perspective, because if it's a long-term injury, or maybe there's somebody who's had many injuries before, you might need a bit more psychological support. So in terms of counseling or psychotherapist or different healthcare professionals to try and kind of mediate their mood as well as deal with their medical problem.
Yes, it's very important just to to make them understand their situation,
Yeah.
and try to make some psychologists, yes,
Correct. Yeah,
mental, yeah.
absolutely.
So, what your advice you can give to young athletes or patients to protect their body for long run? Yes.
I think for anyone, there's a couple of important things that they need to remember. That one is they do need rest and recovery. Rest and recovery is very important. So it's not about just keep pushing yourself to the limit every time. It's about having time for your body to recover, having time for your mind to recover, and factoring this into your training and competition programs and whatnot. The other thing is, as we get older, it's important to be mindful of injuries, and if you start having aches and pains here and there, don't just ignore it. Get it looked at early, and sometimes it's dealt with easier at an earlier stage than at a later stage. As we get older as well, it's important to incorporate more strength. So what a lot of people do is they just go out and run, or they go out and play football, and they don't do other things beyond that. And what we know is that flexibility is important, strength is important, and incorporating other forms of exercise is also important in terms of maintaining your health and your fitness as well. So it's not just about what you're doing in terms of your sport, it's about how you build the other parts around it. And then finally, it's about engaging with different people. So whether it's massage therapists, physiotherapists, your psychologist, your doctor, whoever's looking after you, really engaging with them so that you can try and they can try and help you as best as possible.
Yes. Okay. So thank you very much, because now I can understand more about your career, and yes, your sharing is very important for my student, and very valuable for the people to prevent and also treat their injury and avoid the entry in during exercises, and it's very useful. Okay, once again, thank you so much for
No problems.
Give me precious time for me.
Yeah.
Thank you so much.
No problems. Thank you.
Yeah.
Okay, good. Let's see.